that, you'll use the panel dashboard on your screen to type in any questions you have. And I may come in and talk during the webinar as I'm helping to advance slides in case there's a technical issue to bring up. And a recording of this webinar will be provided on the website for this RFP, and Julia can go over that during her portion, as well as a copy of the presentation will be provided to you. And we'll be posting a recording on the DFSS YouTube page, which you can find in the CSD updates, or if you Google Department of Family and Support Services YouTube page. And with that, I'll turn it back to Bea.
All right, thank you, Tom. So we're on slide 3. And it should be a graphic of all of the program divisions within DFSS. Children's Services was created in 2009. DFSS provides a comprehensive, client-oriented human service delivery system that employs a holistic approach to improving the quality of life for our most vulnerable residents. DFSS supports services that enhances the lives of Chicago residents, particularly those most in need, from birth through their senior years. DFSS provides families with the resources they need to not only create a strong developmental and educational foundation for the young, but across the lifespan, by coordinating services for vulnerable youth, adults, and elders through its various program divisions. Next slide. In 2016, DFSS launched a strategic framework with a dedicated to community, its residents, and families that seeks to improve the lives of all Chicagoans. Next slide. DFSS has contracted with agencies to carry out directly high-quality services to enroll children and families, and we're guided by these 3 priorities: maximizing access, reducing barriers to access, matching investments to community needs, improving the quality of our programs in order to meet children's needs, creating a system of supports, and reducing the administrative burden on our providers. Next slide. We serve vulnerable families in low-income communities and provide high-quality, developmentally appropriate services that wrap around the child and family. In order to do this, we ensure a child's health and physical needs are met. We engage the parents and understand that in order to support them, we must recognize that they belong to families who live in communities. Chicago early learning sites are in these same communities and are funded by DFSS to operate programs like the federal Head Start program and the state-funded Preschool for All and Prevention Initiative programs. And now, Nicole Kraft will be describing the scope of the Health Support Services RFP. Nicole.
Good afternoon. The Department of Family and Support Services administers Chicago early learning programs through a network of contracted direct service and support service delegate agencies. Currently, the Department of Family and Support Services contracts with a network of 100 direct service delegate agencies across 351 sites. These programs may be delivered through a center-based, licensed family child care homes, and home-based home visiting models, and may operate full or part year. Next slide, please. Under this request for proposal, The Department of Family and Support Services is seeking a support service delegate agency that can help the Children's Services Division and its direct service delegate agencies and sites achieve the following priorities. Number 1, strengthen its health services system, including relevant policies and procedures that ensure that health-related program performance standards are met, both across its network of direct service agencies and sites and at individual agencies and sites that fail to meet the Children's Services Division's health-related monitoring performance measures. Number 2, develop innovative and effective.
Nicole, this is Tom Mose, if you don't mind me interrupting. What slide are you on, please?
Number 8.
Okay, I'm sorry about that, because I'm going to go to 8. Here you go. Thank you.
Okay, no problem. Number 2.
It's up now.
Okay. Number 2, develop innovative and effective practices for improving children's health at the grassroots level that can be delivered through a direct service delegate agency's daily or ongoing practices and improve health outcomes for low-income children and families. Next slide, please. Program requirements. The Health Services Support Service Delegate Agency will be required to develop and deliver training sessions and provide technical assistance and consultation in the area of health services to the Department of Family and Support Services and its direct delegate agencies. DFSS intends to contract with one entity to provide services citywide that can meet the following required qualifications. Next slide, please. The successful respondent must have on staff or under contract at least one licensed pediatric doctor of medicine or doctor of osteopathy who can serve as the primary consultant to DFSS and co-chair the Health Services Advisory Committee and its health subcommittees. Identify a project manager who acts as the point of contact for all activities related to the scheduling and coordination of services and activities. Demonstrate the staffing capacity and credentials to conduct the services and activities required of this contract, including having on staff or under contract 7 to 10 full-time employees, including registered nurses, licensed practical nurses, or nurse practitioners. Demonstrate expertise in children's health and healthy development, community health and its impact on child development, and social determinants on health and how they impact children's health and development, as well as gynecological health and lactation consultation. Next slide, please. Demonstrate a working knowledge of one or more of the following and demonstrate the capacity to acquire expertise in all of the following. Health requirements for children ages birth to 5 in Chicago Early Learning programs, including Head Start Program Performance Standards, Chicago Early Learning Standards 2.0, the Illinois Early Learning Developmental Standards, the Illinois Early Learning Guidelines, and DCFS licensing standards. Demonstrate the ability to interpret and explain health policies that affect children ages birth to 5. Demonstrate familiarity and compliance with all HIPAA and Family Educational Rights and Privacy Act requirements. Demonstrate experience providing training and technical assistance to adult learners on topics related to health services. Next slide, please. For a full understanding of the Chicago Early Learning Program standards as it relates to health, we've included a list of resources with this presentation, and this presentation will be made available to you at a later date. Next slide, please. Performance measures. The Health Services Support Service Delegate Agency is required to develop and deliver training sessions and provide technical assistance and consultation in the area of health services to the Department of Family and Support Services and its direct service delegate agencies, in order to improve direct service agency performance and compliance with all federal and state guidelines that govern the Chicago Early Learning Program. Performance outcomes may be assessed in the following manners. After receiving intensive training and technical assistance from the support service providers, direct service delegate agencies will demonstrate compliance with the Head Start program performance standards, the Illinois Early Learning Developmental Standards, the Illinois Early Learning Guidelines, and the Chicago Early Learning Standards 2.0. Additionally, the support service provider shall administer pre and post training surveys that assess the impact of training on the attendee's knowledge. Next slide, please. To monitor and recognize intermediate progress towards the performance indicators, DFSS also intends to track output metrics that may include, but are not limited to, the number of trainings provided, the number of intensive training and technical assistance provided, the number of completed direct service agency training plans and corrective or quality improvement plans, the number of community partnership collaborations supported, including the number of medical homes obtained by Chicago Early Learning children who are enrolled in the programs, number of hours provided to the Health Services Advisory Committee and subcommittees, the number of parent trainings conducted, the number of materials for parent education created and distributed, the number of delegate and partner agency site observations and consultations conducted, and the number of individual child and pregnant mom plans that are supported. Lastly, DFSS encourages applicants to propose additional indicators and metrics, including those that demonstrate early success and are indicative to participants' progress. This concludes our overview of the performance measures, and I'll now hand the PowerPoint back over to Bea. Thank you.
Thank you, Nicole. Now we're going to go over the selection criteria. In this particular slide, you see strength of proposed program. Applicants will be asked to respond to questions related to the required core elements, which are identified in the program description of the RFP. An effective program model for the right target population and desired results. We will ask you in this section to describe approaches to education, training, health issues, trends, and innovative strategies that you've employed. We'll ask that you describe your approach to providing intensive training and technical assistance to organizations that are failing to meet program standards. Next slide. Under this section, program performance, outcomes, and quality. How the agency has performed in the past, and if the agency is committed to performance management and measuring outcomes over the last 12 months. If relevant, you are to upload any report, studies, or documentation that demonstrates the results and accomplishments of your program. You may want to describe in this section a collaboration that resulted in improved health outcomes or access to health care for children and families. You may want to describe at least one partnership that resulted in better outcomes for the child or the health community. And again, if you have documentation, reports, studies that you would like to upload to further demonstrate your efforts, this is the section in which you would do that. Next slide. Organizational capacity. Describe relevant staff positions and qualifications. Your organization's monitoring of program expenditures and ensuring appropriate fiscal controls and records are in place. Your policies and procedures, including hiring practices and the ability to fill essential positions in a timely manner. Next slide. Reasonable costs, budget justification, and leverage of funds. We want you to talk about the agency's financial capacity to operate the program, cash flow and capacity to expend funds prior to reimbursement, matching funds, including in-kind contributions that you will use for this program costs that are considered to be reasonable given the nature of services provided and requirements for this program. Next slide. Deadlines, the application deadlines. The application is due to be submitted on June 23rd, 2020. It has to be here at noon. You will have to be registered in our system to submit. No emails or fax proposals will be accepted. And now I'll turn it over to my colleague, Julia.
Hi, so I'm here to discuss how to actually make an application for this opportunity using the city's eProcurement application system and website. So we're going to go to the next slide. The application, as B said, the application deadline is June 23rd. It's at 12 noon. I stress to everyone to please give yourself enough time to write a good application and really budget. I'm going to say this multiple times during this presentation, but really budget, you know, up to an hour to doing the actual submission. The submission into this process takes you through a couple of screens. There might be errors or things that you need to correct. There might be things you need to update. It's not a simple like hit submit and it's whooshed away kind of experience. So we're going to go to the next slide here and talk about the technical assistance that's available to you. If you have questions on registration, if you have questions on the eProcurement system, you basically need to like commit to memory this customer support at cityofchicago.org, or you call 312-744-HELP. That will also put you in touch with a live person. You can call me, and my number is in the email, it's at the end of this presentation, but it's also in the RFP document, or you can Google me, or you know, there's a million ways to get my phone number. You can call me with questions about eProcurement, and I will also try to help you, walk you through stuff. I have a lot of, you know, PDFs that I can send with very detailed screenshots and instructions. We're going to go through a few of those things right now. But so there's a lot of different ways that you can get up to speed on making your application, but I will say just give yourself time, especially if you're new to this process. It is sometimes technically difficult, and we want to just make sure that you have the opportunity to make the best application that you can and that you get it in on time. As B said, and I've said, we cannot accept any late applications, and without re-releasing the entire RFP, which we very, very rarely do. And so it's very important that you get this into the in on time. So going to the next slide, here's a few application tips that I have sort of set up for people, my recommendations, and how to best navigate the eProcurement environment. So as I said, start early. If you haven't done business with us before, you're going to need to register into the iSupplier eProcurement system, and I suggest you do that as soon as possible. There's links within the application. You can Google it, and within the City of Chicago website, how to set up a registration. You fill out a few screens, and then it goes off to the procurement department, which is outside of DFSS, where it's reviewed, and you will be sent a link. And that takes anywhere from an hour to like 4 days. So again, this is not a last minute kind of application thing. The other thing I like to tell people is to please review your the RFP document. We spend a lot of time writing the document, making sure that the scopes are accurate and helpful. We develop our application questions out of our selection criteria, and we develop our selection criteria from the scope document itself in the RFP. So if you are looking for ideas about what we are looking for, you really should read that scope. If you are at an application question and you're like, I don't really know what they're looking for, refer back to the scope and make sure it's in alignment with the application criteria. And that's a really good way to sort of start answering some of the questions that we're asking so that we can determine who's really going to be the best and most capable contractor or, delegate agency for this project. Again, carefully review the selection criteria. Just a little bit on the mechanics here. There's a 4,000 character limit, which includes punctuation and spaces allotted for each response, which in the eProcurement environment is referred to as a requirement. So every requirement, which would be application question, has a box, a text box that you can write into that's limited to 4,000 characters. Now, eProcurement will not tell you that you've gone over 4,000 characters, so we really suggest that you write your responses in a Word document and do a character count through that, and then cut and paste it into the eProcurement environment. The other thing that eProcurement isn't going to do is once you submit an application, you can't see what you submitted. So we really encourage people to build and maintain a separate application document that you keep, on your file, so you have the language, you know what you've said, and you have that for reference, because once you submit your application to us, you really can't access it again if you want to use that language again. eProcurement works best in the Internet Explorer browser. I have used it with success in Chrome and in Safari and Firefox, but it was built to be in Internet Explorer. If you're finding that you're getting kicked out, things aren't being saved, you're having problems, go and use it in Internet Explorer and save yourself the heartache. The other thing about eProcurement is that it don't use the back button on your browser in eProcurement. Click around to the different screens. Everything highlighted in blue is going to be something that you can click to next. If you use the back browser button, what will happen is that it will seem like everything is working, but when you go to save, it will kick you out of the system and it will have not saved anything since you used the back browser button. And who wants to do more, have to redo stuff? So we're going to go to the next slide. Some tips, more tips for working in eProcurement. I think I've sort of said all of these things, is that one of the nice things is that you can submit your application in eProcurement, and then prior to the deadline, you can go back in and update it. You can go back in and change it. You can go back in and add things, subtract things. So you do have some flexibility. You can kind of quote unquote submit as many times as you want to up until that hard deadline, and then at that point you cannot draw it back. But if you're worried about getting a submission in, I'm telling you, an incomplete submission is better than no submission at all. And so I really do, you should think about that as a tactic. We do suggest, avoid the rush and possible mishaps by submitting early. Submissions take anywhere from 15 to 30 to 60 minutes, depending on your familiarity with procurement and kind of how much you might generate. Make use of that eProcurement hotline for help. It's 312-744-HELP. And note that the hotline operates during business hours only, Monday through Friday, 9 to 5, as do I. The hotline is if you don't get an answer, leave you back within 2 business days. You can call me or email me. I tried to return all of my emails and calls within 24 hours. And that I usually, if somebody calls on the weekend, I do try to call you back even if it's the weekend. So I'm a little bit looser on when I accept phone calls. But we do try to be responsive to you. One word on hard deadline is that we can see where people are at in their applications and working on their applications, how complete things are. If it comes to that, there's always, I don't think that that's going to happen with this particular RFP, but there are always people who miss the deadline. We can see how far you are in your application, and we can see when you've logged in and out. So if something terrible happens, please just keep in mind that we can, in fact, and if we have to, we do track sort of how often people are logging in and out, and if there were any reasons as to why they missed their deadline. I've been working in eProcurement for 3 years. The system has never crashed. There are plenty of times when it doesn't work or play nice with other people's computers, but it, generally speaking, is a very solid system. It doesn't tend to crash. If you are working in eProcurement up until the deadline and all of a sudden your application is whisked away and you cannot find it, it means that the deadline has passed and your application has been whisked away because the application period has closed. And that's kind of the unpleasant way that it likes to tell people that, you know, they've missed the deadline. Going to the next slide here, we're going to talk now about how to accept an amendment. We frequently do an amendment to all of our RFPs to include frequently asked questions that are generated from our webinars or from other, you know, from phone calls and emails that we get from applicants. If we find an error in the RFP itself and we need to make a correction, we will do an amendment. So chances are pretty high that you will in fact have to accept an amendment either to start an application or to continue working in your application. When you accept an amendment on something that you have already, if you've already started your application and the amendment comes out, you will, when you go to log in, you will be forced to accept the amendment, and the process of accepting that amendment will bring all of your previously saved work forward into the amended RFP's application. So you won't have to recreate. If we go to the next slide. So here we have, you know, if the RFP you are interested in has been amended, in order to start the application, you'll need to acknowledge and accept the amendment. And furthermore, to continue your application, you'll also need to acknowledge and accept the amendment. And this is like about 5 screens of acknowledging and accepting. So to accept the amendment, to start the process, you're going to go into this screen and you're going to view the amendment. If you want to look at how the amendment happens. Okay, well, if this is the screen I have here is if you hadn't actually, sorry. The screen I have here is if you hadn't started an application, you're going to go to this actions box and hit create quote, a pull down box, and you're going to hit go. And then we're going to go to the next slide. And this is what you're going to get when you try to start the quote. If you go back if you've already started an application and you're going into the amendment, going back into your application, you're going to experience the same thing. You're going to get this particular screen that we're looking at now. To open the RFP itself, you would click on anything in blue, and eProcurement is something that will take you to somewhere else. If you want to look at the amended changes to the RFP, you're going to click on the infinity or eyeglasses thing. So you can either get to there by clicking on the thing I've circled on 1, which is the document number, or you can look at the review changes, and those will both tell you what the amendment is about. And then after you've done that, you're going to hit number 3 to acknowledge the amendment. And by acknowledging the amendment, you're indicating that you are aware of the changes made in the RFP, and that would mean that basically we expect you to be responsible for those changes. So please read that, what we have amended. That's why we're telling you about it. And going to the next slide, after you hit that acknowledgement button, you're going to go to another slide where you accept the terms and conditions of the RFQ by checking this really small box, and then you click on acknowledge so that you can so you've accepted your amendment. Now you've acknowledged the amendment. When you hit the acknowledge button, we're going to go to the next slide, and you're going to confirm that your acknowledgement, and you'll do that by basically reading the screen and then selecting yes. So you can see that the city is very serious about making sure that you understand that you're taking full responsibility for the knowledge and the changes that have been explained in the amendment. So after you hit that yes button, you're going to get this final acknowledging and accepting screen where you basically say that you understand that that you accept the terms of conditions of the amendment. And to do that, you first are going to go to the bottom of the screen and hit the little box that says I have read and accepted the terms and conditions. And then you're going to go either to the top right hand or the bottom right hand screen and hit the button that says accept. And then you will have accepted your amendment. At that point, it will take you to the screen where you either continue with the application that you started or get to create the new application. And so that is the how to accept an amendment process. So moving on, we're now going to talk about how to submit the application. It's a little bit more pleasant, right? How to submit an application. So going to the next screen. So it's when you are ready to submit your application, I want you to save your draft one last time. So you're going to click on the save draft, and then you're going to click continue, because that's how we start the submission process. Then we go, after that, what happens is the eProcurement system will scan the entire application that you've made, and it will let you know how, kind of if you're in good standing. This is where people frequently, if there is something that you forgot to do or forgot to add, you'll get these error messages, which can be a little cryptic. So I do two of the most common error messages. One says here you must quote on at least one line in the RFQ. To solve this one, you'll look down you'll see right below where it says, right below the error message, there's a tab that says header, a tab that says lines, and you're going to click on the lines. So we're going to go to the next slide. So as I say here, usually the error messages direct you to something left undone in the application. And in the example that we're doing, it said the error message had said that the lines had not been filled out, and so you're going to click on that lines, that lines tab, and it will take you to where you would fill out the lines. Now, if we look in the next, if we look on the next slide, okay, whoops, I'm sorry, I've gotten all confused here. The next slide will say I have the, the next slide I have here is that, you have to quote at least one line.
Julia, this is Tom. I'm on the slide in this example. The error is about unanswered question in the application.
Perfect. Okay, so so this is, thank you very much, Tom. So in this slide, I am following along. So in this slide, we talk about an error that is about an unanswered question, which in eProcurement is referred to as a requirement. So in this case, it's the requirement is the missing requirement, or the quote value is quote value required. And when it says quote value, it means you didn't answer something. And requirement would be eProcurement's terminology for an application question. And the first name is the name of the application of the application question that's missing. So you would go down into your header, you go down to your requirements, open them up, and you should be able to see it says, first name, and then you would fill out the quote value in this case. So let's go to the next slide. Once your application is free from errors, you are ready to proceed and submit. And so at this point, you're going to save your draft one more time, because I believe in drafts, and you're going to hit continue. And that will and when you're error free, it will, instead of giving you an error message, it will put you into your the review and submission phase, which you can see I've circled it, so it will tell you that. Why don't we go to the next slide?
This is Tom again. After the slide, this is the last chance to even confirm, is that?
Yes, that's not what I'm seeing on
your-
my screen, but I hope if everybody else. Yes, that's what.
At the bottom of the screen.
Nope. No, go back one, please.
Okay, this is your last chance to review.
So we're going to,
Okay.
This is your last chance to review all your data. So this is what when you're going into the review and submit phase, you're going to be able to check your attachments. You're going to be able to see all of the answers. You're going to be able to really go through your entire document, your entire application document in eProcurement and see everything. If you scroll to the bottom of the screen, we'll go to the next slide. You'll see at the bottom, you'll be asked to provide an electronic signature. So this is sort of the pro tip, is that you need to fill in the name and your title before you check the little box in the electronic signature box. If you do what I did at first and check the box first and then fill everything out, you get it sort of just, it can't cope with that. So fill out your name, fill out your title, check the box, and then you're going to go and hit submit, which is on the lower left-hand, the lower right-hand side there. You'll click submit, and then we'll go to the next screen, and you will get a confirmation screen that says that you have successfully submitted your application. So, and then you will be submitted. You will have achieved greatness in the eProcurement system. We're going to go to the next screen. And so, yeah, this is what I have to say about eProcurement, how to do this. I understand it's kind of a lot of technical information. I have plenty of PowerPoints and slides that I can send you. I can talk to you on the phone. I can answer your emails. This webinar is posted and sent out to all of the people who attended it. So you should be able to have this information at your fingertips when you need it. But this is a good introduction as to what it's going to take for you to make a successful application, and maybe a little bit of an idea of like how much time it will take. So that is pretty much what I have to say. I'm going to hand this back to B, and I guess we can take questions if we have any.
Okay, and I guess that means we did a very thorough job. Next slide, Tom. But we also realize this is a lot of information for you all to get at one time. So if you get questions, even after this webinar, please feel free to call me, call Julia. We'll put you in touch with Nicole. We want to make sure that we're there to answer any questions that you do have. You have our information there. We also have a central Dropbox, but if you use that, I highly recommend that you put the RFQ number in the Dropbox. But I'd rather you just make a personal contact to me or to Julia so we can really respond to your question. So Tom, is there anything else?
Hi, V. No, there's no more questions. So that concludes the presentation.
Okay, well, thank you so much, everyone, for joining us. And we will definitely get this PowerPoint back out to everyone. Thank you.